Hello, everyone, and welcome to our, I want to say October, but it's not October yet, September Community Cafe. We're so glad that you're here with us this morning as we talk about suicide awareness and prevention. We have some wonderful guest speakers that are going to share resources with you, and we want to encourage you to ask any questions that you might have. Open dialogue is encouraged. Um, Jerry and Robert are going to be monitoring our chat. So if you have anything you want to pop in the chat, we'll be able to respond to that, and you can interact with each other in the chat if you'd like. We are recording the cafe this morning, and we also have closed captioning that's auto-generated by Zoom. So if that's distracting to you, you can turn it off. Again, welcome and thank you all for being here as we go through talking about suicide and how it impacts our communities, and hear from community members and advocates that are boots on the ground and working to help stop suicide, prevent suicide, and spread awareness in the community. So our first speaker up is Crystal Hobbs. She is with NAMI Lake Norman. So I'm going to turn it over to Crystal to let her talk to you.
Oh, thank you. Good morning. Hope everybody's doing well today. It does feel like fall already. Like I said, I just, like to introduce myself. I'm Crystal Hobbs. I am the president of the NAMI Lake Norman Iredell affiliate. So what that is that our affiliate provides resources and free classes and support groups for our communities that are dealing with mental illness. We work in conjunction with the therapist and with the prescriptions to give people the tools, the resources, and help with the communication skills that they need to navigate through the chaos and the ups and downs with our loved ones that have the mental health disorder. I also give a little bit of background of how I got involved with NAMI. A lot of people still aren't really familiar with NAMI when we go out into the community, but it stands for the National Alliance of Mental Illness, and we do partner a lot with partners, and we're very thankful for partners' resources. I use you guys a lot for resources and for people that I come across that are in mental health crisis to get that frontline help and that frontline defense and try to de-escalate the situation if possible without having to take them to the emergency room or now call 988. I got involved with NAMI 4 years ago after our 15-year-old son Tristan took his life. He was a sophomore at Mooresville High School, and it really came without any warning. And when I say it was a shock, it was a shock. He was one of those people who he was just very good about masking his feelings. One of his coping skills later on that I found out through getting involved with NAMI and learning about communication is avoidance. So he was really good about hiding and avoiding difficult situations from his loved ones. So he did not reach out for help. He did not ask for help. But I am one of these people who I have two children. I told him and his sister, Raven, who is now 24, we've taught both of them that knowledge is power. And I told Tristan, although he had a diagnosis of ADD when he was 6 years old, that's not an excuse to get out here and not do anything. We all have skills, we all have tools that we can utilize and make the world a better place. But I just didn't realize, how much of a caring, loving person he was. I knew how he was at home, but then it was only after his death that I had some of his friends come forward and tell me that Tristan would go to the EC class at Mooresville High School and give all the kids in the EC class a hug and, tell them to have a great day and they were special, and he, at 15 years old, you just don't see a lot of 15-year-old males going up to, people that are different and, giving them a hug and making them feel, really special. But we now we started a 5K event, and I wanted to do something. It was just put on our heart when we found out Tristan was the second suicide at Mooresville High School in 4 months. And in the year of 2018, he was one of 6 students in the Iredell County area to take their lives by suicide. So I realized that we have a problem, and unfortunately, the school system, their stance was, well, we don't want to sensationalize the act of him taking his life. We don't want to draw attention to it because we don't want other kids to do what he did. Well, like I told the principal who's no longer there, I said, well, if they're thinking about it, if they're going to do it, they're already thinking about it. You're not going to plant the seed. That's a myth. So we started the T-Man's 5K. It's a walk and run event at the Mooresville High School, and it'll be next Saturday at 10 a.m. And we usually have between 200 and 300 participants that walk or run. And this year we have the Steve Smith Foundation coming as our guest speaker to talk about their new mental health facility that they're opening up in 2023. And I also have a lady who started Dale's Dachshunds for depression. She's actually donating 2 of her miniature Dachshunds to 2 teenagers for emotional support therapist dogs. So she has really gotten instrumental, and we're able to tag team and just network within our community to share resources and people's talents and our passion, because we realize that it's not only our teenagers, but it's a lot of people that are dealing with mental health that don't have a history of mental health in their family, such as genetics, but it's also the external factors that we're dealing with in our society that is, having people just struggle with day-to-day, anxiety that could lead to depression. So we're just trying to break the stigma surrounding mental health and the mental health disorders. I try to use the T-Man 5K as a voice for people to find their voice to ask for help, because there are other Tristans out in the world that need help that don't know how to ask for it. And to do better, we have to know better. So I'm very passionate about, through NAMI's platform and their educational platform with their classes and their support groups, of being able to really educate people that are dealing with mental health disorders, the diagnosis, and then the wellness and the recovery, because there is hope. It's not a hopeless situation. It's just we don't understand enough about mental health to really understand what is going on with ourselves and our loved ones, and then how we can get them back into wellness and recovery. But NAMI Lake Norman Iredale, just so you guys are aware, we have 3 support groups that are going on right now in Huntersville and Mooresville. At Huntersville United Methodist Church, it's the 3rd Monday at Huntersville United Methodist Church. We have a connection support group, which is for the peer or the person with a mental health diagnosis. We talk about different resources for them, medications, what works for some. It's where peers share their stories and their struggles with their mental health disorder. And then they talk about what works for them, what didn't work for them, things that upset them, how they were maybe talked to, if they had to call deal with the police, if they were incarcerated. It just gives them an open, safe place to talk about their feelings and what they've been through in their journey. That's from 6:30 to 8. And then we also have a family support group at Huntersville United Methodist Church the 3rd Monday at the same time. So a family member that has the diagnosis, and also the loved ones living and taking care of the person with the mental illness, they can get support at the same time. So that's 6 to 8:30. And then at the Mooresville Public Library, we have a family support group. It's the first Wednesday of every month, and that's 6:30 to 8. And all these support groups are free. There's no registration. You just walk in and come as you are, where you are. It's just a safe place to where we can talk about, what's going on with each other, and try to help each other get the resources and if the medication, as needed. So that's what I have in a nutshell. And if anybody has any questions or anything they want to add, or anything we could do better in our communities to help, I'm all ears.
Crystal, I had a question. What would you tell parents to say to their kids regarding this subject? I mean, is it okay to just ask, or what do you recommend?
Yes, absolutely. The more honest and the more open we can be, and I've learned, like through NAMI, our stance is, we want to be non-judgmental. And y'all are going to talk more about this, but QPR does a really good job of really being straightforward and just put it out there. Just say, I know that you guys have a lot, thrown at you, You know, we need to be open and honest with each other. You need to let me know where you are. And if you have thought about taking your life, I need to know. And it's just that simple. But we have to be calm, and it's hard to stay calm when it's frightening. It's frightening to think that our child or our loved one is in a place where they are thinking of self-harming.
Thank you, Crystal.
Thank
And
you.
I have a question for you. As far as the support groups go, can you talk a little bit about like grief support groups and if you guys work with hospice and their support groups, and how you may work individually with people that are experiencing grief and loss?
Okay, right now NAMI itself does not do grief support groups. Typically, you know, we let different organizations do that within the church with their therapists and things of that nature. So right now I can just say we are empathetic to grief. And of course, if we deal with a lot of people that have lost loved ones to, you know, to suicide, or they've contemplated or attempted suicide, but they did not, thank goodness, carry it out. But our stance, well, I guess our niche in our community is just to educate before it gets to the grief process. And then if the grief comes into play, then that would have to be another avenue to take within the community.
Thank you so much for sharing your story with us. It's extremely powerful. And I think NAMI as a whole and other advocacy organizations like mental health associations, they are such wonderful tools for being able to work directly with people. I know some of the NAMIs that I've worked with have gone and sat with people in emergency departments. They've helped people get their medication, and they really are boots on the ground, connecting with people and providing that protective factor of you have somebody to talk to, you have somebody to lean on, and this person is not going to be judgmental. They're going to connect you with resources, no wrong door policy. And I'm speaking from partners, you all have been wonderful partners, and helping with that awareness and education piece, but also a lot of mentoring. And I learned this expression in mental health first aid a long time ago, but the ministry of presence and just being with people and listening to them. So I commend you and thank you so much for everything that you guys are doing. And I know that you work with a lot of volunteers that are just passionate about what you're working on and helping people in the community. So everybody on the call, if you have an opportunity to volunteer for NAMI, support their events and things like that, we can share the link to the website, excuse me, and you guys can check it out and see how you can get involved if that's something that you're interested in, because it really is a powerful organization. So thank you, Crystal.
Thank you.
Crystal, I have one question, because I know we've got 14 counties, and regarding NAMI, there's probably some counties that don't have a NAMI, especially some of our smaller ones. What would those counties, because like I said, I know there's some smaller county representation on here. Could they reach out to you if they wanted to at least get started?
Yeah, so what they could do is they could reach out to us or NAMI North Carolina on the Raleigh level. If they don't have representation and they want to start their own affiliate, they can do so. But you brought up a good point, because we have a lot of overlap, even though we service Iredell County. Huntersville and Cornelius are in Mecklenburg County, but they would fall under NAMI Charlotte. But it's so difficult for people that live in these surrounding areas like Davidson, Huntersville, and Cornelius to get to Charlotte, you know, to get involved and get the resources. So we actually play, you know, we help with them, you know, we help those areas. And it doesn't matter where the help comes from as long as they get it. But I mean, you know, the main thing is that the more sites and the more locations that we can provide our services at, the better off we will be in getting getting immediate resources to those people who are in crisis and need it, like giving them partners website or y'all's 800 number, to share, because I actually had to use you guys about 3 months ago with a young lady, and y'all were partners, did a great job. I got a therapist on the line with her. We were able to de-escalate the situation quickly. So within an hour and a half, I had her calm where she wasn't a harm to herself. So, it takes all of us to work together, and that's wonderful. I mean, it's good that we have these resources nearby.
And I'm
Crystal,
gonna,
we
I'm
did have
sorry,
a
Jerry, go
request.
ahead.
Oh, I was just gonna say, Crystal, can you put your email in the chat? We did have okay, Robert just put it in. There was a request to reach out to you. Thank you. Sorry, Katie.
No problem. I was just gonna turn it over to you to do chat stuff, so you're on top of it. And again, thank you so much, Crystal, for sharing that. And
Thank
so
y'all.
our next speaker is Michelle Paget from Lincoln EMS. Michelle, you are up.
Thank you, Katie. And I appreciate the invitation to be here today. And one of the things that I wanted to just expound on what Crystal said is a lot of times we don't know what we don't know. And when we know better, we do better. And I think that's awesome that she said that. Again, my name is Michelle Paget, and I'm the training coordinator for Lincoln County EMS. I've been a paramedic for 15 years. This is kind of a third career for me because I'm a little bit older than folks coming right into school. I've been a training officer, a field training officer. I've been a supervisor, and prior to last year, I worked night shift the whole time. Last year, I became the training coordinator here at our agency, and that was a really big adjustment going from nights to days, I can tell you that. The topic of suicide is one that is very important, which is why we're here today. And suicide in first responders actually claims more lives than line of duty deaths. And if you think about that, with all the stuff that's going on in the recent years, that can be a big number. So there's not a whole lot of research on the subject when it comes to first responders, but there is a white paper that was delivered by the Ruderman Family Foundation, and they've got great resources that on their website. Some of the statistics they had in 2017, there were 103 deaths by suicide for firefighters and 140 deaths by suicide in law enforcement. And that's compared to 93 firefighter line of duty deaths and only 129 law enforcement line of duty deaths. In 2020, we all know, COVID was here, is still here. The majority of the deaths in first responder world was through COVID-19, but there were still a lot of deaths by suicide, and the number did not decrease. Whereas I know some of the statistics have shown that overall in the general population, that number has decreased, but it has not in the first responder world. Something interesting, EMS providers are 1.3 times more likely to die by suicide than the general population. So some of the things that I did want to talk about is some of the barriers with either reporting this and things like that. So the reporting part of this is another facet of it. When I talk about that there were 93 suicides or 116 suicides, that number is probably double. There's a big stigma in the first responder world, whether it's law enforcement, firefighters, EMS, or dispatchers. They don't report it because they fear that they may lose their job. And some programs don't recognize suicide as a line of duty death. So they don't get, the memorialization, and they don't get the funds. A lot of times in line of duty deaths, families get, compensation, which kind of weird to even say that, because nothing can compensate for the death of a loved one. But they do get some financial assistance from that. So what are some things that contribute to first responder suicide? Well, the occupation comes at a high risk. This is on top of some of the personal demographics, medical issues, economic strains, and the other determinants of health, which we're all familiar with. Relationship problems have been linked to the highest number of reasons why there is suicides in first responders. And most of the time, this is due to families and loved ones not being able to relate to the first responder due to the trauma that that first responder has experienced on the job. So some other things that are listed as reasons for first responder suicide is, of course, depression and addictions. We experience those. The shift work that we have, we often miss meals, bathroom breaks. We work in all kinds of weather. We're on duty 365 days a year, 7 days a week, 24 hours a day. We often miss family gatherings, birthdays, holidays, and we are not guaranteed to get off on time. So that can affect families in a big way. Some other things that contribute to the stigma surrounding asking for help for first responders is they fear that their counseling sessions may not be confidential. Employee assistance programs a lot of times do not have counselors that are trained to be able to understand what first responders have gone through, and heard many stories that when first responders do go talk to a counselor, that the counselors are actually traumatized by some of the things that they may hear from us. So that can play into it as well. Another thing is workers' compensation. Mental health injuries are not easily, proven. So claims for mental health are often not covered under workers' comp. And I think when I was doing some research, there's only 4 states that actually have laws in place that say that they will cover that. So what can be done to help prevent first responder suicide? One of the things is to encourage wellness programs for employees, especially with helping them understand the importance of sleep. One of the things that we do at our agency is we limit the number of hours that people can work. So if they work 18 hours, then that's all that they can work. And we make sure that they have at least 8 hours off in between shifts and or classes, because we have a lot of employees that are going to paramedic school. We kind of train our own while we've got them working for us. Another thing that would be very beneficial is to start any type of resiliency training early on in their careers. It would be best if we could do it while they're in school or in their academies, letting them know, what can happen and how to take care of themselves. Let's see. So one of the things that our agency has done, and we've been very fortunate, is we applied for and received a SAMHSA grant last year. And it was a training grant. So we have done over 3,000 hours of training surrounding mental health at our agency since November. So not even a year, and we've trained about 3,000 hours just on this one topic. One of the programs that we've done is called Stress First Aid. It was a program developed through the Veterans Association, and this program basically reminds us to check in on ourselves and to check in on our partners, and it kind of teaches us some things to help relieve stress. We are training some mental health counselors on our culture. We've invited them to do some training with us so that they become familiar with our jobs, get acclimated to, how we do things, and also get to know some of us as well. We have purchased some computers with secure conferencing software in them, so that if we have employees that need to talk to a counselor, that they can do that here through the video chat type of thing. And then one thing that I did want to throw a plug out to partners in Phoenix. They helped us with some crisis intervention team training. We trained 97 employees on the CIT training. And part of that was the QPR training, which was very beneficial. Let's see. Something else that we offer, critical incident stress debriefings. Basically, those are meetings, I guess, that you could call it meetings that we would have after people experience traumatic incidents. And we have folks that are trained to talk to the folks and help normalize the situations that they've gone through. Let's see. So the last thing I was going to talk about is what can we do going forward? So one of the biggest things that when you're doing research about suicide and first responders is that there is not one national database that collects all the information for first responders. So law enforcement has one, fire has one, EMS really doesn't have anything. We're kind of lumped in with the firefighters. The dispatchers and telecommunicators, they get forgotten about most of the time in anything. So having one national database where all this information can be collected to help us learn about, the causes of it and different things like that. The other thing is to train more mental health professionals that understand our background and our culture. We would like to invite folks to do ride-alongs with us, educate them on what type of calls we run, how we communicate with each other, and what we do after traumatic events with counselors that are trained in the critical incident stress management program. Developing peer support programs. And that's one of the things that we're trying to do here at our agency, which takes some additional training. If there's not enough resources in our county, we would like to partner with other counties for the training on that, because some of the training can get somewhat expensive. So partnering with other agencies would be helpful with that. And then lastly, encouraging, I know I've talked about the critical incident stress management and debriefings. This is a evidence-based program that helps first responders normalize their stress reactions after they've experienced a traumatic event. And basically it teaches them that they are having normal reactions to an abnormal event. Our bodies normally react certain ways when we've got high stress going on. And we help normalize that through the debriefings that we have. And the last thing that I just want to say is we want to remind our employees that it's not punitive and that it's okay to ask for help. And one of my favorite sayings is it's okay to not be okay. Everybody has days when things are just not going their way, and that's okay. I guess that's the last thing I'll have to say. Does anybody have any questions?
Michelle, have you seen any outcomes from all of the work and training that you've put in? I know that it hasn't. You've been doing it. You might not have been doing it long enough to see any outcomes, but I'm just curious. Have you seen any like short-term or long-term outcomes?
So part of the grant requires us to keep data and statistics on the training hours, and then one of the goals that we did have in the grant was to improve the stigma here at our agency. So looking at how many events we had where folks asked for debriefings, or we did one-on-ones with folks, just talking with them. I feel like people are asking for it more often, asking for that help more often. And we're keeping track of all that stuff, and we'll be reporting that back to SAMHSA. We actually got an extension on the grant because we didn't spend all the money, because part of the grant was for us to pay for sessions for our employees, but we didn't finish training all of our counselors till right before the end of August. So we got the extension for another year so that we can continue that and use the rest of that money in that way. So next year, hopefully we'll be able to give you some like hard statistics on how that's done, because we have a company that's helping us with surveys and stuff like that we give to the employees and filling that out. So we're going to be really excited to see how those numbers look once we finalize everything.
It's such a neat initiative that you're doing. It's a complete culture change.
It is.
So like in your day-to-day work, have you seen a morale change in your staff just from having that additional support and resources?
Yeah, we really have. One of the things with the stress first aid is the program, and I just have one of the things, it's really colorful. The flyer poster that we have, we put these up in all of our bases, and it kind of reminds everybody to check in on each other on a level like, are you a green today? Are you a yellow today? And so people actually see that and they remember, hey, check in on yourself and check in on each other. So we've heard comments after we've done that training that, oh yeah, I was an orange today, or, and so hearing people say that, we know that they halfway paid attention during class.
Very cool. And thank you. It really is impressive, all of the hours and work and time and just really passion that you guys have put into really making this shift toward a very supportive and protective environment for your employees. It's really incredible.
Yes, we're very fortunate that our administration, and not just myself, because I'm new in the administrative role, but our administration here is very, very supportive in the wellness and mental health of our employees here. So yes, we're very lucky, and I'm happy to be a part of this initiative.
Well, thank you. And thank you for setting that standard.
Mhm.
And so up next, we have our very own partners, LaQuisha Martin-Hillian.
Hello. Thank you so much, Katie, and thank you everyone for joining us today. So I am with partners, actually the geriatric adult specialty team. And what we do is our team goes out and we like to enhance the knowledge that centers around topics about older adults. And we speak with different organizations and agencies who go alongside our older adults. And of course, that could be from EMS, first responders, churches, libraries, just as some of everyone in the community, just to enhance that knowledge. And some of that information is centered around dementia and Alzheimer's, as well as mental health and substance abuse. So I would like to share my screen here. Let's move this up for a second. Okay. So what we know is that it is a myth. Not all older adults are lonely, nor are all older adults are depressed. A lot of older adults live happy and fulfilling lives. But there are some challenges that they face just as we face them. So some of the challenges that they may face is family loss. As we get older, we will experience losses. So that can be definitely a challenge that will be at the forefront with older adults, spouses, family members, friends. But there's also social isolation, and that can be stemmed from many different things. It can be due to not a lot of social support in the home or outside the home. It could be due to medical reasons, physical disabilities, medical disabilities. And then we also have the lack of sense of safety as individuals get older. Some, and I do emphasize some, not all, may become frail, and there may be an increase of falls, which can then lead to hospitalizations and oftentimes rehabilitations. And when we look at rehabilitation, the transitions is also something that older adults face, transitioning from home to long-term care or home to living with family members. And for us, we know that that can definitely impact their independence, their overall well-being or sense of self, as well as a sense of purpose. So if we think about it, how do you feel when you're having to depend on other people, for other people to, if you've had an incident where you were sick or wasn't feeling well and someone had to help you bathe and groom and those things. And that can place oftentimes a strong impact on a person's ego, self-esteem, their identity. And so a lot of times the sense of purpose can decline and decrease when the independence factor comes into play. And also, we may not think about it, but retirement. A lot of people think, oh, retirement is something great, and it is. But oftentimes for older adults, that's where they get their identity, is in the workplace. They've worked there for 20, 30 years, and they know who they are, and people know who they are. But when they transition from workplace to retirement, then they're often sometimes may focus on who am I now? So that can definitely be a challenge that older adults face, as well as financial problems. Not all older adults, but there are some older adults who may have a fixed income. And I have worked in the healthcare field for about 13 years prior to coming to Partners as a social worker. And during that time, what I often found was older adults would definitely not report that they had any financial concerns. But what I did find was that they would often have to determine if they would pay for medications or if they're going to get their groceries for that week. So a lot of times it was having to kind of investigate a little bit, so to speak, and to approach them in a different way, not to say, I know you have financial problems, so let me help you. Instead of doing that, what I would typically say is introduce myself and say, I'm LaQuisha, I'm a social worker here. Just thought maybe if you don't know, these are some of the things and services that I can help you with. And that is so that we do not, put them in a position to be defensive, but also just giving them that dignity and the respect that they really do deserve. So I did learn that definitely in those 13 years of being in the healthcare field. But also there can be some physical disabilities and pain that as we grow and as we get older, age and get older, there are often pains. Now, I don't know about you, but this right leg of mine right now has some arthritis in it with past ACL tears of playing basketball. So my bones popping already. So it definitely can be a challenge. And not only as 65 and older, but as a 44-year-old as well for myself. But what we do know is depression can affect all ages. But it is definitely not a part of normal aging. Again, not all older adults have depression or been diagnosed with depression. But again, as our speakers have spoke about it, we all have had bouts of depression episodes. But please know that it is serious, but it's treatable. And we do know that. But a lot of times our older adults may not seek help due to a lot of things that we all may go through, the stereotypes of just thinking and assuming that all older adults are just depressed and all older adults are lonely, which is not the case. But oftentimes older adults do want to cope in their own way, don't we all? So a lot of times if we think about it, how did your grandparents, how did your parents deal with stress as you were coming up? I know for mine, they did not speak about it. They would, for some of the people that I knew and love who has gone on and passed on, they would reach for higher power, or they would work through it, or they would say, you know what, I have no control over it. So whatever is going to happen, is going to happen. And then that brings us to the reasons why they're so unfamiliar with mental health professionals. It's because they haven't been exposed to it or wasn't exposed to it. And if we think about it, it really wasn't encouraged to do. But definitely times has changed and we do have a lot of growth to make, but it's definitely been a lot of growth in any ways. And then we speak about the cost, definitely. And again, with fixed income for some older adults, then they may say, I just don't have the money. But there are a lot of other ways that you can receive mental health services now, especially churches are one of the big ones that you can reach out to, and I'll speak about later. But also, we don't look and think about hospice and palliative care for individuals, especially during grief and loss. And I can definitely speak on that because that's something that I did years ago. And it can be helpful. It's very low cost. It's actually free, or they take donations. and heard Miss Michelle say this, it is okay not to be okay. And oftentimes, if we just share with our older adults to say, look, I've had my moments of feeling down and depressed. I've had my moments of speaking to a counselor or a therapist, and this is what I did. This is how I felt. What are the pros? What are the cons? And just being actually transparent and honest. Did I like it? Not in the beginning. No, I did not like it. But was it worth it? Definitely it was, because it brought forth a lot of things that I realized that I didn't do or didn't know about myself. So that would be some of the things that I could definitely share, because that is something actually that I experienced. But what I also would say to them is that, it helped me to better myself, to find some coping skills and coping mechanisms to some things that I just didn't know about. And letting them know that, we all have problems, whether we want to share it or not, but we all have problems. So if anything, definitely just be transparent and honest in bringing forth those pros and cons about therapists and mental health professionals. And as we know, suicide is not just about older adults, it affects all ages. And what we know is that older adults tend to often plan more carefully with suicide. Excuse me, and they're most likely to use more lethal methods like firearms. So not only researchers and doctors, but we do also encourage caregivers, especially those who are caring for individuals who have dementia. We encourage them to either remove the firearms or to make sure they're locked and secure, because oftentimes as we know, dementia is the cognitive component, and memory is definitely the highest component of dementia. So as time progresses, of course, the memory is affected. So what we know is oftentimes someone with dementia may not even be able to recognize what an object is. So that's one of the reasons why they request to remove those firearms, because it can be just accidental, or it could be something that they just don't want their families to go through, to see them go through, to not only lose their memory, but to not even know how or who they are, recognize their faces, having to bathe them, take care of them, the whole person, the whole self. And a lot of older adults, or some older adults, may not want to do that. So that is some of the other reasons why you can see suicide in older adults as well. And then when we look at loneliness, there are some individuals, older adults, who are lonely, and that stems from many different things, of course, estranged relationships in the family. It can also be just not being integrated into the community, not knowing what they can and cannot do. It could be an impact of their physical disabilities or their differences in regards to the medical realm. Grief and loss. Oftentimes we look at our older adults as a pillar of strength. They've gone through it. They've experienced grief and loss so many times. They've seen it. They've done it, but they hurt too. And we often forget that they hurt. We forget that, how they have dealt with things in the past could have also built up. And maybe they didn't get through that loss or many losses that they have experienced before. So that's a buildup of loss and grief. And then it can bring them to think about their own death, or bring forth an enhancement of anxiety and hopelessness for themselves. And then when we look at the loss of self-sufficiency, having to depend on individuals to help them through when they've been so independent for so long and for so many years, that can definitely cause a weight and strain on an older adult. And then those chronic illnesses and the chronic pain, to have to take the medications and it's not really taking care of the pain, or they're sleeping a lot more, they're depending on individuals a lot more. All these things starts to pile up, and it starts to be more and more things to weigh on their shoulders. And we spoke about cognitive impairment in regards to dementia. Again, with some older adults, they just don't want the family to see them in that way. They don't want to be a burden if they are diagnosed with dementia or Alzheimer's. So this is some of the reasons why older adults have or commit suicide, as well as the financial troubles. So when we look at this, oftentimes it can be what we call, with grief and loss, a secondary loss. So if a older adult loses their spouse, they're grieving their spouse, that is a loss. But what if that spouse brought forth that financial gain? Now they've lost income. That's a secondary loss. But now they're having to determine, well, am I going to have to move into long-term care, or am I going to need to move into with family or friends? That's another loss. So now you're looking at transitioning. I'm not going to be able to take all my belongings. That's memories, that's belongings. Those are losses. So those losses continue to build, and the pressure begin to enhance. So a lot of times that is what we see in our older adults. And when we look at how and when we should, refer someone, we're going to look at the behavioral and the mood components. And what we do know is that it's going to be different for each person. Every older adult is not the same. But even with these types of signs, we want to be sure and definitely encourage you all to know the individual, get to know the individual, because someone who may be sleeping all the time may not be at risk of suicide or depression. It could just be a side effect of the medication. So we want to be mindful that although these are some of the signs, you want to definitely be sure that there hasn't been any medication changes or any recent diagnoses that could also display some of these signs and symptoms. And this goes along with mood swings, mood signs, because they can mimic some of the other things that may be transpiring in their lives. So we want to, again, encourage you to know the individual, get to know them. And then there's a sense of hopelessness. What does that look like? What does that look like for you all? Or what does that look like for other ages? It can definitely be the same, and it can be different. But when we start to find that where they're pulling away from the family, friends, they're not going out as much as they used to, they're not even wanting you to visit them. They're refusing all types of help, of going to the doctor, spending time with the doctor, and trying to figure out what is really going on. When they start to say, the world will be better off without me, or, what's the use? So those are some of the things that we can definitely be triggers and be mindful of when you're speaking to older adults, because not all older adults speak that way, and not all people speak that way. So that is definitely something to look out for. And then sometimes just ask. Why assume? Ask and listen. So don't fill in the blanks. Don't rush them through it. If they need a minute to pause and to think about what they're sharing, how they're sharing, give them that moment, because understand that that's moments that they need to identify how they are feeling. And just remember how you feel when you're not feeling so well, and when things are just piling up on your shoulders. And when someone is trying to talk to you, to ask those questions, to have to hear yourself, that also places a pause, to know that you're going through it, but to hear yourself say what you're going through can definitely have an impact. So, but definitely asking and being open posture, giving eye contact, that definitely goes a long way. Not judging. And I often encourage people not to ask the question why, rephrase that word, that question, just so that they won't be placed on the defense. So asking questions is okay. Asking questions after question, you might want to pull back from. Just give them a moment. And oftentimes they definitely will open up. but you want to be sure that you're listening. You want to be there, physically be there if you can. If you cannot, you definitely want to be sure that someone is there, reaching out to their loved ones, friends, family, congregation, not sharing all of the things. Definitely, you don't want to do that, but just arranging and making sure that they are engaged in the community by connecting them. We want to be sure that we're connecting them to mental health professionals. We want to be sure that we're connecting them to the community. And if they are not able to get out due to some type of mobility issue or anything in regards to that, you can also have services brought into the home. There's always a call, a check-in to let them know that just thought out, just thinking about you. How are you doing today? Did you follow up with the individuals that I linked you with? Did that work for you? Do you need for me to help you with anything else? Just letting them know that you're there. And that is the most important thing. And so just being mindful that older adults are individuals, and it doesn't matter about age or, my grandmother would always say, nothing get old but clothes. And she would always say that. And she would always be the one out there playing basketball or trying to shoot in the hoop, as she would say. So just be mindful that they are individuals. And when we say promote emotional wellness, we're looking at the whole self, of course. We want to ensure that they're engaged physically and emotionally, making sure that they're going to their doctors, because we do know that primary care physicians they do screen for depression. And this is one of the places that older adults do go very often. And they may not share with the physician or the doctor, the nurse, that they're having bouts of depression. However, they are skilled in knowing how to ask those questions. And that is one of the ways you can definitely get that help. But we also encourage you to enhance their knowledge and know that older adults are filled with knowledge. They're very wise, and just be creative with it. You definitely can be creative in ensuring that they have that support mechanism. It's not about the number. It's definitely about the quality of support. You want someone that's going to build them up, not tear them down. You want to be sure that you are empowering them to be their best self, as well as you would want someone to empower you.
LaQuisha, and I'm so sorry for interrupting, but I do want to do a time check and offer out, if anyone would like to reach out to you for more extensive training on this specific population, and to see if you have a few thoughts to wrap up, just because I want to touch on QPR before we close out, and we're in the last few minutes of our session here. So I do apologize for interrupting.
No worries. Definitely. Places where you can encourage older adults to go is definitely church, senior centers, and senior living communities. And if you need to reach out to me, this is my direct number, my email address, and I do have colleagues that we can definitely come out and do trainings. There are only an hour PowerPoint trainings. And again, they center around different Alzheimer's, dementia, as well as mental health.
I really only needed to give you 30 more seconds. I kind of jumped the gun there, huh?
Okay. Thank you so much.
No, thank you, LaQuisha. It was a wonderful presentation. So does anybody have any questions for LaQuisha? And Robert has included her contact information. Our GAS team does do trainings, and they're a wonderful resource. So if you have any questions about that population or want some follow-up, feel free to reach out to LaQuisha or any member of her team. And so the last item on our agenda is to briefly talk about QPR. And QPR is a training that Partners offers. It's offered through a lot of community agencies, but we do offer it for free also. And it stands for Question, Persuade, and Refer. I'm going to share my screen with you. I have a brief one pager here that we can also send out to you all too, if you want more information. Let's see, let me make sure I have the right screen here. So this just gives a basic overview of QPR. It stands for question QPR training. It's very digestible. Oh no. Can you guys hear me okay? My Zoom went down for a minute. Okay, good. Sorry about that. What is going on with my internet here? I see my I'm so sorry about that, guys. I'm not sure what happened to my Zoom there. But so we can tailor it to fit time slots. It takes about 90 minutes to do the whole training. But a key element of it is something that was mentioned in all three presentations, and that to prevent suicide, you need to inspire hope in people. And oftentimes that hope is inspired through connections, whether that's connections with peer support, connections with your coworkers, connections with your family members. That really is the driving force behind all of the suicide prevention initiatives that I've seen. So I hope you all keep that in mind, that anyone can help prevent suicide. And QPR is a good foundational educational tool to help people understand that. And Kevin Hines was a big spokesperson for suicide prevention and QPR. And when I first started doing QPR years ago, one of the most impactful things to me that he said in one of his speeches was that, and if you all don't know who Kevin Hines is, you can Google him. He's a wonderful speaker on suicide prevention. He attempted to take his life by jumping from the Golden Gate Bridge. And so when he was on the bus on the way there, he was just distraught and he was visibly upset. But he was also ambiguous, and he thought to himself, if one person asks me if I'm okay, I'm going to tell him. I'm going to tell him the truth and I won't do it. But nobody asked him. And so the more I thought about that, you know, that everybody on that bus wasn't just jerks. So why wouldn't people ask? And personally, what I think is that people are afraid to ask because they don't know how to follow up with that. They don't know what to do. They're scared of telling the person the wrong thing or saying the wrong thing or connecting them to the wrong place. And so if we empower the community with the tools to do that and to be able to feel confident to ask and that they can help the person, then like we have the real potential to help prevent suicide. And that's my soapbox about it. If you'd like more information on QPR, Jeannie and her training team are usually on our community cafes. They're wonderful trainers. They can come and help fit it into the needs of any group that you want to train up. So again, I appreciate you all. I'm going to turn it over to Robert to close us out. Thank you all so much for listening. I hope you got a lot of value out of this conversation.
Thank you, Katie. And I did put some information about QPR in the chat. So if you are interested, you can feel free to contact Jeannie. I put her phone number and email address. And like Katie said, these trainings are for free, so please take advantage of them. But we'd like to thank you for joining us for this month's Community Cafe. Next month, we are going to be talking about transition to independent living for individuals with developmental differences. So we'll have some local agencies speaking on just how to help out individuals, get them the resources and opportunities that they need. So I thank you so much for this, for joining us. And real quick, I did see a question in the chat that I wanted to address real quick. Is there a school training for QPR that children know how to do this for peers? If anyone knows that. Oh, wait, Crystal Hobbs. So Brandy, if you want to reach out to Crystal, she can connect you to that training. So thank you again for joining us for our community cafe. We hope everyone has such a great day, and we will see you next time.
Thank you all.